Good morning, good afternoon, good evening, and good night to all my people around the world. This is Stop By, local, regional, and international, home and abroad. To some people, this might be breaking news. To some, they already know, but give thanks, you know the news. There are currently 13 people in quarantine in Jamaica and one individual in isolation as the government continues to take steps to lessen the likelihood of the dreaded coronavirus entering the country. Health and Wellness Minister Dr. Christopher Tufton revealed the number on Wednesday afternoon as the ministry gave an update on effort to keep the disease at bay, or at least to contain it should it breach the local shores. Tufton sought to assure that Jamaica remains vigilant in its effort to protect the population from the novel coronavirus. A statement that followed the press conference explaining that each traveler from China will be assessed to determine the type of quarantine to be applied. This assessment will be done using a special risk assessment tool, it said. Is that right? Because, a lot of times people think the whole Caribbean have this thing locked, but I don't think so. So, let's read. Those determined to be high risk will be quarantined in a government facility. Those determined to be low risk will be quarantined at home and will be followed up daily by healthcare teams at the parish level. And as the number of coronavirus deaths near 500 globally, with more than 20,000 people infected and at least 25 countries affected, Tufton reiterated that the restriction on travel from China, the epidemic center of the outbreak, remains in effect. This means that in addition to the usual port health and immigration rules and procedures for air and sea and craft, for travelers who have visited China in the last 14 days, the following will apply. Only Jamaicans, national, permanent resident, and those with marriage exemption will be granted landing privilege. All travelers will be subject to immediate quarantine for a minimum of 14 days. Travelers who show any symptoms of the novel coronavirus will be put in immediate isolation. Quarantine facilities are provided by the government in some cases, and isolation facilities are operational at public hospitals. Meanwhile, the ministry is to spearhead the setting up of a national coordination mechanism as instructed by Cabinet. According to the ministry, based on information currently available, the new coronavirus behaves in the same way as other coronaviruses, which means that the normal processing of goods coming into the country would have rendered them safe. The ministry also noted that while the World Health Organization, WHO, is currently reviewing measures to deal with the global demand for the medical mask, Jamaica does not currently have a stock out of such masks. I hasten to add that wearing a medical mask is not recommended, except for those persons who will be in close contact to symptomatic individuals. In fact, it may create a false sense of security that can lead to neglecting other essential measures, such as proper hand hygiene, Tufton said. In terms of effort to protect frontline workers, the ministry said the following have already taken place, which is engage 329 frontline employees at the Norman Manley and Sangster International Airport, including immigration, customs, port health, airport police, Jamaica Fire Brigade, aviation service, various airlines, and management staff at port. Training sessions have focused on the new coronavirus with respect to roles and responsibilities of the point of entries, as well as facilitation of prompt recognition of infectious or potentially infectious person and implementation of appropriate interventions. Sensitize some 50 senior nursing managers and 50 physicians from the public health system across the island. Sensitize 50 clinicians from the private sectors. Sensitize representatives from the various professional health groups, including the Medical Association of Jamaica, the Association of Government Consultants, and the Jamaican Medical Doctors Association, together with the professionals supplementary to the medicine group. This is Stop By, share, like, and comment, and subscribe.